Senator Linda Berglin, thanks for joining us today.
You're welcome.
You know, during your tenure in public office, you served with 7 different governors. You saw one president of the United States resign from public office, and you saw the first Black American sworn in as president of the United States. In your opinion, is this country and the state better off today than it was in 1972 when you were first elected?
Well, there are things that have changed for the better, and there are things that have changed for the worse. You know, in 1972, we didn't have all of the home and community-based services that we have today to help our elders and disabled citizens be able to live and be full contributing members of our communities. So this is a good thing that we have made those kind of changes. We're a little bit closer to having more people with health insurance than we were then, and so this is a good thing. But I worry a little bit that we are losing our sense of community, that we're losing our sense of being part of a neighborhood, part of a state where people are there for each other when they need to be. Because I see so many things going by the wayside that have been important and have been helpful to people when they need.
Such as?
Waiting lists now, long waiting lists sometimes to get services. Reductions in police and fire departments at the local level. Reduced library hours. Larger class sizes.
Okay. Let's move on and talk a little bit about how the institution of the Senate has changed since you were first elected here in 1980.
Well, there weren't as many women, needless to say. I'm glad there are more women now and that it's more of a usual thing, not an anomaly, not something to talk about even. I think there's more decentralization of power in terms of, you know, having more participation by members in the decisions that are made. I think it's been a hard last 9 years with budget after budget needing to be cut and deficit after deficit. So I'm hoping we can recover from that and be having times that are a little easier in the future.
Okay, and now one of your major accomplishments while in the Senate was the creation of the state's Minnesota Care program. It helps provide health coverage to low-income Minnesotans. Do you think this program has become the envy of other states?
There are a lot of other states that would like to have a program like this, and there are other states that have had a program like this and don't have it anymore. So yes, I think so. And it will be helpful to us when federal health reform does go into place to have people already in some kind of coverage so that they'll be able to transition and our budget will be able to transition more easily.
Any concern it might get dismantled when you're no longer here?
Well, I did not think the repeal of the Minnesota Care tax in this year's budget bill was a good thing. We are going to need that money for implementing federal reform and for making sure that we continue to have coverage for everyone. But I believe there will be others that will be ready and willing to step up to the plate. And because it is a good program that many people all over the state rely on, and maybe not for a long time even, but just for a hard time during their life when they're unemployed maybe, or have to take a job without health benefits. I've heard from a lot of people that have said, you know, it helped me for a couple of years and I really needed it then. So I believe the program will continue in some form and that the people in the legislature and Governor Dayton's administration will step up to the plate to make sure that it remains a viable program.
And since healthcare is your area of expertise, how do you respond when most folks, Republicans and Democrats, agree that the cost trajectory of healthcare spending is unsustainable. What's your response and perhaps your advice to direct lawmakers down the road?
Well, the first thing I would say is that cutting rates to providers and cutting eligibility for certain programs in healthcare or cutting people off altogether, that does not amount to health reform. What health reform is about is providing services differently to keep people with chronic conditions healthy and helping them be a partner with them in their own health so that they can remain productive citizens and they don't end up in an emergency room, they don't end up in a hospital unnecessarily. And making those changes in the delivery system is not easy. It's not easy for anybody to change, but it's certainly not easy for a system that is not very well organized, as medicine is, to change. And I believe also that in order for this to work well, people need not only health care, but they need social services brought in. So, you know, if you're homeless, pretty hard to be healthy if you don't have a place to live that's safe.
Given that you are such a champion for health care, particularly for the state's most vulnerable, how difficult of a decision was it for you to move on and leave the Senate at this time?
Well, the position that I have taken gives me an opportunity to serve many of the same people and to work on many of the same things that I'm passionate about, but to do it closer to the ground and to actually see policies that I have hoped would be implemented actually being implemented. So
same work, different structure.
Yes, I'm excited about the new opportunity.
You seem like it. Good. So I want to ask you, is there any work that you think has been left undone as you do leave the Senate?
Oh yes, of course. But there's always work to be done because things always need to keep changing. Health reform needs to continue to be implemented at the state level as we get ready for being a partner with the federal law. And that will mean things like rethinking how state-operated services works, for example. We, of course, have moved backwards a little bit in terms of the things that we have made available to children. Child care was cut. Mental health for children was cut a little bit. Adult mental health was cut. So there will be things that people need to take a look at and see what, if anything, can be done to buoy up those structures.
Any advice for lawmakers moving forward?
One of the things that's been so great about being in the legislature for me is working with so many groups of people, being able to learn so much over the years. It's been just a great educational experience for me, and I hope others will look at the job the same way and use the opportunity they have to keep learning and growing and being able to improve the way they serve Minnesotans.
And what would you like to say to your constituents? You've been representing them for almost 40 years.
They are the greatest. You know, they've never wavered. I've never had to worry about, you know, trends that would take place in politics. They were rock solid. And so it's been really a pleasure to serve them. It's been an opportunity that I will cherish all my life that they've given me, and I appreciate the trust they've placed in me. And I will still be there for any of them that ever need me.
All right, Senator Linda Berglin, congratulations on your new post, and thanks so much for joining us today. We certainly appreciate it.
Thank you.